Spinal stenosis is one of those diagnoses that's really not very helpful. From a point of view of knowing your prognosis, you as a patient, having spinal stenosis can mean something really, really severe, or it can be a basic statement of fact. And understanding what is causing your stenosis is the most important thing to knowing how much scope you've got for actual relief. Because in a lot of cases where it's of a certain type, you can actually do really, really well. In some cases, unfortunately, it's actually a lot more difficult to deal with. So in this video, I'm going to try and address those two bits. Obviously, we'll focus a little more on the one than the other, but we'll address both of them. Now, first and foremost, spinal stenosis essentially refers to a hole is smaller than it should be. Now, that might be that something's occupying that hole. It could be degeneration. It could be something more sinister than that. It could be a degree of disc bulge or tissue inflammation, etc., that's occupying that hole. And we're talking about three holes when we're talking about the spinal stenosis. First one is that this little hole in here where the spinal cord runs through, and that is less common. The second one is going to be these little holes where the nerves exit. And it's worth mentioning briefly before we go on, if spinal stenosis is incredibly severe, you get symptoms of cauda equina. This is considered a red flag, so you want to check out our video on that on our YouTube channel just to make sure you don't have it. That's very important. So we'll assume for this video you do not have that. Now when we're talking about the more severe version of spinal stenosis, this is when you've got arthritic change or severe degeneration through the spine that's causing bones to proliferate and reduce the size of that natural bony canal. And this can be in the cases of two main things. One is spinal arthritis, and this is significant and severe degenerative wear and tear, where these little facet joints here enlarge, where there's compression of the disc and growing backwards of bony osteophytes, and that is creating a smaller gap for the spinal nerves to leave, or the spinal cord in the middle. The second variation within that group is going to be something like a spondylolisthesis. And that's a bit of a mouthful, and you can check that out on the website on the What We Treat section, because we go into more details there. A spondylolisthesis is where one of these joints, you'll notice that I can't shear them on this model because they're blocked by the fundamental structure of the spine to provide stability. But sometimes you can get damage to this section or this junction here between the back and the front, and that causes a vertebra to slip, and that makes the hole smaller as well and can result in spinal stenosis. Spondylolisthesis can be in 4 main grades, which you can read more about, as I mentioned. Now those are much more difficult. Sometimes treatment can help those patients to provide relief, but it's a little bit more complex, and if you think you've got that variation, you should definitely get in contact with us just to see about what we can do. We'll normally need some sort of scans or images to actually understand better the degree of spinal stenosis, but if you think you've got that, you already have the scans anyway. So the next variation, which is a lot more treatable, is soft tissues, commonly disc bulges. And you can check more out about slipped and bulging discs and herniated discs on our website, but essentially when a disc bulges, like so, it creates or occupies some of the space, and this leads to spinal stenosis. Now if you go online and you look up spinal stenosis, you're going to get a lot of bad stuff which is going to make you very worried, but you won't get necessarily this stuff unless you're coming on this video, because a disc bulge that leads to spinal stenosis, because the disc bulge is occupying the spinal canal, will be very treatable in a lot of cases. And it's that stenosis that invariably presses on the nerve, giving you the sciatic type pain down the leg if it's in the lower back. And when it comes to treating this sort of stenosis, it's very similar to treating the disc bulge, because the disc bulge is the problem. Stenosis is just a comment or a statement of fact. It's not really very useful in this particular case. But frequently we'll have patients coming in saying they've got stenosis. You look at an MRI report or previous reports from a surgeon or the consultant that they've seen, and it says, yeah, there's a disc bulge here, which is obstructing the lateral recess or something to that effect, leading to stenosis. And they've only picked up on that one word which is known, rather than reading the whole context of the report, because you guys necessarily, or I wouldn't expect, are trained to read those sorts of things. So it's understandable that this misconception takes place. Now treating these sorts of cases of spinal stenosis is very simple. We've got a compressive pathology, as you've probably heard in some of our other videos, where we're squashing down on that little water balloon. It's creating inflammation around here. It's got an injury there. So we want to decompress that section using IDD therapy. We want to get those tissues to start healing better using laser therapy, so that the ligamentous structure of the disc and the soft tissues around there start to heal more effectively. We want to address the muscle spasm that frequently is associated with that using the vibration therapy. And the stiffness and rigidity of the spine that often co-occurs here, we want to move that around a little bit more, get a bit more mobility through the spine with our spinal adjusting. And in a lot of cases like this, it's necessary to get some degree of rehabilitation done at home to really complement treatment in the long term. So that's pretty much how we'd approach the spinal stenosis. But it is a bit of a funny one. A lot of patients do have it and they really don't understand what scale they have it at. So if you've got any questions, please use any of the contact modalities on our website to get in touch with the team and just find out if we can help you.